Health, heads of departments, representatives from regions and organizations, colleagues and friends. It is a unique moment in time that we all make it to be together again after 2 years for this 26th meeting. Let me deeply thank our co-organizers, the city of Moscow, and the various departments. And it's very unfortunate that we have also this year to be remotely, but we are very happy you're all on board. This meeting will last for 4 days, and it has 4 sessions, and Natasha will be introducing this further. And I just would like to brief you on a couple of technical aspects before handing over to the chair of the meeting. And these are, the meeting is broadcasted on the RHN Moscow website. For speakers, panelists, chairs, and moderators, you should have received a personalized Zoom link. If you did not, please contact our secretariat. And a generic Zoom link is available for everybody to listen and to look at and to make comments. As per WHO protocol, I now would like to ask if there's any objection against the program. I assume it's all fine, so therefore approved. And I now would like to hand over to our chair of this first part of the opening, Dr. Natasha Azzopardi-Muscat, who is our director. Natasha, the floor is yours.
Good morning, good afternoon. Thank you very much, Bettina, for opening the session. And it is my pleasure to chair this first session. I would like very much to thank the government of Moscow for co-organizing this important meeting, which will offer all participants from the regions from health a forum for discussion for the first time in 2 difficult years. The meeting scheduled for 2020 was cancelled because of the COVID-19 pandemic, which is still very much raging. At this 26th annual meeting of the Regions for Health Network, it will be even more important to discuss how in these network meetings we will have a deep dive into the WHO Regional Office for Europe Program of Work, the EPW, which identifies the Regions for Health Network as being supportive of local living environments to enable health and well-being. The proposed objectives for this meeting this week are to position and strengthen the network and its members' collaborative activity in the light of the new European Programme of Work, in the light of the recently adopted Regional Plan for Implementation, and of course, in the light of the lessons learned from the COVID pandemic. And secondly, to provide an opportunity for the representatives of the network to interact together and with international experts and organizations on topics that are critical to development in the regions. So during the meeting together, we hope we can further shape future joint priority and activities so that we can update our terms of reference for the focused activities of the network in the coming years. And also, no doubt, it will be an important opportunity to share lessons on specific themes, including COVID-19 and what this means for universal health coverage in our regions and healthier populations with a specific focus on climate change and environment, linking very much to the wider concept of One Health, which was one of the key recommendations of the Pan-European Commission for Health and Sustainable Development. And with this, it is my pleasure now to give the floor to our Regional Director, Dr. Hans Kluge. Hans, thank you for making the time in your busy schedule to be with us this morning, and the floor is yours.
Thank you very much, Dr. Azzopardi Muscat. Honorable Deputy Minister of Health, Deputy Mayor of Moscow, heads of departments and delegations, colleagues and friends. Let me thank the Moscow government and the Ministry of Health of the Russian Federation wholeheartedly for promoting and co-organizing this 26th annual meeting of the Regions for Health Network, very close to my heart. Over the next 4 days, 30 Regions for Health, international organizations, NGOs and scientists, more than 66 speakers, moderators and panelists will come together to share experiences and the key priorities. As we know, the pandemic is far from over, as the epidemiological statistics from a number of countries in the WHO European region clearly tell. This is not a time to let one's guard down. This is a time to step up and strengthen our actions. Getting vaccinated, vaccines save lives, maintaining physical distancing, cleaning the hands regularly, covering and sneezes, avoiding crowded closed spaces, ensuring ventilation of indoor spaces, and wearing a mask all contribute to preventing the spread of disease and avoiding death. The impact of COVID-19 continues to be catastrophic, felt in every sphere, every corner of the world, with 1.4 million deaths in the WHO European region alone. The pandemic is an unprecedented shock to health systems. There were shortages of almost everything: beds, health workers, even oxygen. In many countries, routine activities such as primary care and mental health services effectively ceased. Suspension of some activities, like cancer screening, is likely to have a profound impact for years to come. The past 2 years have been characterized by loss, learning and adversity, but also solidarity, scientific breakthroughs and progress. COVID-19 has taught us countless lessons, a key one being that much more can be achieved when we work together, multilaterally. We have learned the immense value of collaboration beyond borders. We have also learned more about the impact of the natural environment on human health and that of our relationship with nature, which has an enormous effect on the well-being and security of our societies. What is thought to have led to the emergence of SARS-CoV-2 and facilitated its global spread are human activities like deforestation, the trade and consumption of wildlife, and international travel. Climate change has emerged as one of the biggest game changers for humanity. It is already affecting all of us. A conservative 2014 global study has predicted that there will be approximately 250,000 annual deaths due to climate change between 2030 and 2050. The direct cost to health, excluding costs in sectors such as agriculture, water and sanitation, is an estimated $2 to $4 billion a year by 2030. Without significant action mitigating that, there will be a substantial increase in preventable morbidity, mortality, and adverse impacts on the quality of life. This is not only about us. This is about our children and our grandchildren. Climate change and COVID-19 are two converging health crises with a joint way forward. And although time is short, we now have a unique opportunity to build forward greener and more sustainable. Let me give you some examples. The recently published recommendations of the Pan-European Commission on Health and Sustainable Development remind us that COVID-19 and climate action require an equipped health workforce, sound primary healthcare, strong communications, robust emergency preparedness and early warning systems. To achieve this, the Commission in its final report calls on governments to address long-standing funding gaps in primary healthcare, mental health care and social care, while investing and protecting the health workforce. The Commission also calls on governments to proactively prioritize the prevention of communicable and non-communicable diseases, rather than act reactively as they have in the past. The COVID-19 response and climate action also remind us of the fundamental importance and contribution of sectors and settings other than health. In 2019, for instance, anthropogenic confined particular ambient air pollution alone contributed to more than 500,000 premature deaths in our region. Sectors and settings shifting away from fossil fuels would contribute to preventing these deaths. Greener urban design with safe travel infrastructure, location of services close to residential areas, and increased green spaces, reducing fossil fuel use, air pollution, urban drainage, and ultraviolet radiation exposure, on top of promoting physical activity and improving mental health. The challenges are clear, but we also have solutions at hand. The term One Health means recognizing the interconnection between people, animals, plants, and their shared environment. When one part is at risk, others are suffering. The Pan-European Commission on Health and Sustainable Development recommends countries establish cross-government One Health strategies based on the concept of health in all policies. 2 years into the pandemic, there is now a general understanding that health is not a standalone issue. It is a prerequisite for the well-being and resilience of societies and economies, and therefore needs to permeate all agendas: political, environmental, scientific, economic, and social. And all of us have an essential role to play. We and our descendants now face a precarious future unless we take urgent action. The regions for health are at the cutting edge of engagement across sectors for implementation and innovative approaches. And you set the example. That is why your collaboration sites do matter. That is why the voice of Moscow, one of my beloved cities, our host today, needs heard at the upcoming COP26 alongside others in the light of its environmental and climate policy and achievements. I know we can learn a lot from one another, working towards the common goals of the European Programme of Work 2021-2025, United Action for Better Health, moving forward together. And yes, there are many challenges ahead, but we have never been more united nor better equipped to face them. I convey again my personal greetings to the Minister of Health, Dr. Murashko, to the Mayor of Moscow, Mr. Sobyanin, to all of you, and I wish you a very fruitful meeting. Thank you very much. Spasiba vam bolshoye.
Thank you very much, the Regional Director, for your truly encouraging and inspiring words. And now it's my pleasure to give the floor to the Deputy Mayor of Moscow, Mr. Biryukov. Mr. Bukov, the floor is yours.
Добрый день, уважаемые коллеги. Добрый день, доктор Клюге-Ганс.
Good afternoon, dear colleagues. Good afternoon to all of you, Bettina Menne, Mr. Kluge. It is my pleasure and honor to welcome you here at the 26th WTO ATO Regions for Health meeting. Naturally, we're living through hard times, and Moscow, Russia, citizens of Russia, and the whole global community are not exception. And the mayor of Moscow, Mr. Sobyanin, is acting in line with the requirements of the President of the Russian Federation and does his utmost for the Muscovites to live through these challenges in a proper way. 30,000 hospital beds were turned into COVID hospital beds. We're working on psychological support of those who suffered from coronavirus. Vaccination is underway. As you see, we're doing everything to fight this horrible challenge. However, let's not forget that life goes on, and we must do everything in our power to further develop ecological environmental issues of each city. Today, Moscow lays emphasis on the issues such as environment and healthcare, since environment and comfortable environment contributes to 30% of health of the citizens. So naturally, it impacts the health of our citizens, and it is important for us. Over the recent 10 years, we have applied great effort to modernize the energy sector of the city, utilities, industrial enterprises, create green spaces, make its transport eco-friendlier. And recently, Mr. Sobyanin at one of the key forums, Russian Energy Week, emphasized that the population of Moscow has grown since 1990 by more than 30%, but carbon dioxide emissions have decreased by 25%. Air pollutants today represent only half of those 10 years ago. These results were achieved thanks to the effective and efficient work of our energy system and using energy-efficient technology. Over the latest 10 years, energy intensity fell by 37%. Energy generation plants were modernized. 47 inefficient and outdated boiler facilities were shut down. A single heat supply system was introduced. There were built more than 100 million square meters of residential and non-residential buildings. Energy consumption at the same time increased only by 1%, while heat consumption decreased by 11%, water 32%, gas 18%. Thanks to energy modernization, we managed to get rid of non-eco-friendly types of fuel, such as coal and mazout. Today, in Moscow, there are more than 700 electric buses on 56 itineraries, and our plan is to fully switch to electric public transport. According to the Global Capitals rating, Moscow featured in the top 30 cities ranked by air quality, coming ahead of many European cities. Air quality is controlled by the state system of monitoring 24/7, day and night. We have automatic stations, mobile laboratories, and analytic labs to control the quality of air. 15 air pollution control stations are installed in the vicinities of Moscow. One of the key environmental projects of the government of Moscow is drawing to its final stage. I am talking about the Kuryanovsk wastewater treatment plants. The set of measures taken to reduce offensive smells, improve the quality of life of several million people in the south and southeast of Moscow. Moreover, a lot of effort is applied to shut down all the facilities that are emitting unpleasant smells. And naturally, the life of citizens has improved dramatically. Over the 10 years, the concentration of air pollutants decreased by 2.3 times, of suspended particulate matter by 1.5 times. We also have important water treatment quality control. For instance, the tap water supplied to our citizens is controlled, taking into account 184 indicators throughout their journey to the end user. 9 years ago, we started using absolutely cutting-edge technology in water treatment. For instance, 9 years ago, we got rid of liquefied chlorine and switched absolutely to sodium hypochlorite solution. Another important technology we're using is ozone water treatment. One more extremely important factor is the availability of green spaces. Moscow is one of the greenest cities in the world. 49% of Moscow's area is actually green. There were planted 10 million trees and shrubs over the recent 10 years, and 90% of city dwellers live next to parks. What's more, the number of pedestrian streets and areas is growing. Over the 10 years, the area of parks grew to 886 compared to 130 10 years ago. A great number of public places were improved and equipped with services and utilities. 36 embankments of Moscow River, 65 kilometers long, were improved. Moscow is changing right before our eyes. It turned into a city where people feel comfortable working, relaxing, practicing sports. The leadership of our capital is real. According to international ratings, Moscow is a real leader in terms of quality of the city environment. Moscow became the winner in the nomination of Best Tourist Destination, a city
получила эту престижную премию.
I would like to emphasize once again that Moscow became the best city according to this rating.
Благодаря созданию удобных, безопасных, качественных и
Thanks to creating a comfortable, safe, quality and accessible territories in Moscow, compared to the year 2010, the number of pedestrians quadrupled, bicycle rental grew 23-fold, and every third Muscovite now is doing sports. Today, the city managed to maintain a dialogue, an efficient dialogue with its city dwellers. One of the examples of such efficient cooperation is the waste sorting program that was launched almost 2 years ago. Waste sorting is a free choice of every city dweller. The government of Moscow didn't opt for introducing fines, but rather tried to put the message across and really reach its citizens. And the strategy is bringing fruit. Now we're witnessing increasing volumes of sorted recyclable materials. Last year, it amounted to 855,000 tons, 1.5 times greater than in 2019. Dear colleagues, all the above-mentioned factors are just a small part of the issues we're going to discuss today. I am pretty sure that the cooperation of the Russian capital with our colleagues will be mutually beneficial. Exchanging experience is of great importance, and that helps us to move forward. I believe that the interaction and cooperation of Russia, of Moscow, the WHO will continue and become an efficient instrument to exchange experience and technology with the leading regions of the world. And we will reach our key goal, ensuring good health, active lifestyle, and well-being of the citizens. Thank you very much. Good luck to all of us.
Thank you very, very much, Deputy Mayor, for really showing us how, in spite of the increasing population and all the challenges you are facing, you have had so many success stories in making Moscow city very much more a livable place. And I personally look forward to witnessing these beautiful changes that you have brought about, and to have the opportunity also to meet you and your team in person when I will visit Moscow in the coming months. And before handing over to our final speaker, I would just like to apologize that the Deputy Minister has been caught up and will not be able to make it, and to convey our greetings. And now I would like to give the floor to Olga Mamukina, who will be talking on behalf of our WHO representative, Dr. Melita Vujnovic. Dear Olga, the floor is yours.
Thank you very much. В знак уважения нашим московским коллегам позвольте мне зачитать приветствие доктора Вуйнович на русском языке.
On behalf of Melita Vujnovic, I would like to read out her welcoming words. Dear colleagues, I am extremely glad to welcome you all to the 26th meeting of Regions for Health Network. First and foremost, I would like to emphasize the great level of cooperation between the WHO and the government of Moscow. This cooperation has been actively developing in the recent years. WHO representatives have played an important role in the events of the government of Moscow.
С этого времени нам совместно удалось провести обучающие семинары по различным инструментам,
We managed
включая качество
to
воздуха, изменение
participate and to
климата,
organize
пространства,
quite a
общественного
few
транспорта
events
и
in
организовать участие
such
представителей
fields
государства
as
Москвы в ключевых мероприятиях
environmentally friendly transport, green spaces, city development, urban development, and so on and so forth.
Бесспорно, коронавирусная инфекция внесла свои коррективы.
It's an open secret that the COVID-19 pandemic impacted our decisions and our actions. However, we're doing our utmost to cooperate to implement cutting-edge innovations and best practices that are to be taken into account while developing and designing our policies in different regions.
Четверть глобального бремени болезней. Пандемия COVID-19 является еще одним напоминанием о хрупких отношениях между людьми и нашей планетой.
Developed environment can lead to a 25% relief of the healthcare crisis. So I would like to wish good luck to all of us, to welcome you all here once again, and hope for future cooperation. Melita Vujnovic, thank you.
Thank you very much, dear Olga. And I would like to check whether our regional director, Dr. Glucker, has any reflections to make after having heard also the speech from the Deputy Mayor of Moscow.
Thank you very much, Natasha. Глубоко уважаемые коллеги, дорогие друзья, я хотел поздравить мэра Москвы с огромными достижениями создания здоровой окружающей среды
Dear colleagues, I'd like to
мегаполисе.
congratulate the mayor of
Это
Moscow
огромно.
on his great successes and achievements
Спасибо вам
in
большое
terms of
за такое
ensuring
лидерство.
health and well-being of the
Спасибо
citizens
большое
of Moscow.
Министерству здравоохранения,
Thank you very
Михаил
much to the
Альбертович,
Minister
Плагай,
of Health.
и Мирная организация здравоохранения всегда с вами. Я желаю
I'd
вам
like to emphasize
очень
that
продуктивной
the
встречи,
World Health Organization is
крепкое
always
здоровья
supporting you and ready
и
to
до
work
встречи.
together. I'd
Спасибо.
like to wish you good health and see you soon.
Thank you. And I would now like to thank everybody, including all our speakers, and formally declare the meeting open. Your action at the subnational and regional levels is of high importance in the fight against COVID-19 and also against the climate change. You now have 4 really packed days ahead of you where we will all continue to learn so much from each other. I wish you a very successful meeting, and I am very much looking forward to the results and to working with you in the coming weeks and months, together with our coordinator, Dr. Bettina Mede from the Venice office. Thank you, and I wish you all a good day. Please stay connected as the first session will start in a few minutes.
Thanks. There was applause at the end, if you did not hear. So thanks, Dr. Kluge, Hans, and Natasha for opening, and our Deputy Mayor.